These winter storms are delaying vaccine shipments to several states as the U.S. works to pick up the pace of vaccinations. As of Wednesday morning, more than 72 million doses had been distributed nationwide and more than 56 million had been administered. So far, there have been nearly 28 million confirmed cases of COVID in the United States. More than 489,000 people have lost their lives. And the CDC is warning of tens of thousands of more deaths in the coming weeks. Mulalengi reports from New York City.
The storms that have paralyzed so much of the U.S. have also frozen out vaccine deliveries. Shipments are running as many as 48 hours behind schedule. In hard-hit Texas, just 9% of the doses the state was expecting this week have been shipped. Moderna unable to ship any doses to the Lone Star State.
There's certain parts of the country, Texas being one of them, where vaccination sites are understandably closed.
The crunch now acute in the nation's most populous city, which could run out of first doses by tonight.
Supply, supply, supply.
New York City Mayor Bill de Blasio.
We're in this ridiculous situation. We have massive ability to give people vaccination, but right now we're running out again.
The Biden administration now says everyone who wants a vaccine will be able to get one by the end of July. Just be patient, says Dr. Anthony Fauci.
The cure of all of this is when the supply-demand gap closes. As we get into the later months, April, May, June, and July, I think those kind of discrepancies and difficulties are going to disappear.
The CDC now projects as many as 70,000 more COVID deaths just in the next month. And tonight, major news from Pfizer, a study showing its vaccine is significantly less effective against the variant first discovered in South Africa. That variant is now in at least 10 states, and the concern over variants is fueling the race to vaccinate. That's especially important in underserved areas like East Los Angeles. In LA County, Latinos are 3 times more likely than whites to die of COVID. Many here are essential workers like Susan Hernandez, a grocery store cashier.
We've been on the front line for over a year now, and we have not gotten any kind of protection as far as getting vaccinated.
On Tuesday, a FEMA mega site opened in her neighborhood. She was one of the first in line.
Woohoo! I'm excited.
Some of those same discrepancies are playing out right here in New York City. New data shows that the hardest hit neighborhoods have the fewest number of vaccinations. And making matters worse, some vaccine sites, like this one here in Brooklyn, have stopped taking appointments after running out of the first dose of vaccine. Lana?
Mola, thank you. For more, let's bring in Dr. Richard Besser. He's the president and CEO of the Robert Wood Johnson Foundation, as well as the former acting director of the CDC. It's always good to see you, Rich. More than 40 million people in the United States have now received at least one dose of the vaccine. More than 15 million are fully vaccinated. Do you think that this process is now moving fast enough?
Well, it's definitely moving faster. What we're seeing in just about every state is that they're getting their systems down. They're improving on their ability to get vaccine out. What I'd like to see more data on is not just the numbers of people being vaccinated and the speed at which they're being vaccinated, but whose arms are they going into? Are they going into people who are at the greatest risk? Have they started to vaccinate people who are essential workers, those who are working in our food supply, those people who are working in our grocery stores, driving our buses, our first responders, and our teachers? It's very important that that group is included in those who are getting vaccinated.
And as you mentioned, vaccine distribution varies widely state to state. How much is this complicating efforts?
Well, our healthcare system, our public health system, is something that occurs at the local level. There's even more variability than state by state. So it's not something that the federal government itself will be as effective at accomplishing as states and localities will. The federal government has a role to play, and we're starting to see them stand that up in terms of federally administered clinics, and that I think will help get vaccine out to some of the harder to reach areas. But it's really a coordinated effort that's needed between federal, state, local, tribal, territorial, public health, and other entities.
The White House, speaking of one of the specific groups, the White House says that teachers should be vaccinated, but it also says that that isn't a requirement to reopen schools. Should teachers be a top priority group, and should they be given the option of declining in-person instruction if they aren't vaccinated?
Well, back in the late fall when vaccines were first being approved, the advisory committee to the CDC, it's called the Advisory Committee on Immunization Practices, they met and they laid out the recommended priority groups. And the first group was healthcare workers and people in long-term care facilities and those who work there. The second group was meant to be people who were either 75 years or older and people who were essential workers. And that's been lost in the shuffle in a lot of states. Many states jumped right away to anyone 65 and above and left out those who were essential workers, and teachers were in that group. If we're asking people to leave their homes to go to work, if people have to leave their homes to go to work to put food on the table and pay the rent, we should be ensuring that they have the protection that they need. And people who are out there every day meeting the needs of society, and that includes teachers, should be in a high priority group. The good news, though, from all of the studies that have been done in the United States and around the world, is that vaccination is not required in order to get children into school safely for them, safely for staff, and safely for teachers. There have to be resources in place. Vaccine will add to that, but vaccine is not required in order to do it safely.
I was speaking with another teacher who said that she understands the priority group for people who are older, but wondered why it couldn't be set up like a TSA security check line with a priority access for those 75 and older, and then for other essential workers who are willing to stand in line and perhaps wait and see if there's any vaccine left over at the end of the day to be able to potentially to get the vaccine. Would something like that work?
Well, I think a system like that will disadvantage people who, many of whom need the vaccine the most. This pandemic has been hitting Black, Latino, Native Americans the hardest. It's been hitting lower income workers who have to go to work. And the idea that a lower income worker has hours to spend online in order to get vaccinated, it's just not a reality. We need to make sure that vaccines are reaching people where they are. For many people, that's in their local community clinics. It may be in churches. It may be in mobile clinics. And in the future, it may be work-related, where you have worksite vaccination the way we have for flu. But a system that gives priority to people who've got hours in their day to be able to wait for vaccine, or who have access to the best computer technology to be able to get online and register. This is leading to a system where we are seeing some of the groups who were most affected by this pandemic being vaccinated at the lowest rates.
All right. Dr. Richard Besser, thank you.
Thanks so much, Lana.